Cathy, you're back with us today. You were diagnosed with trigeminal neuralgia, and you sought us out for DTR in hopes of getting some relief.
Yes.
So I want to just go through a couple things. One, can you tell me, like, how long have you been suffering from this, and really what your main symptoms were?
It's probably been about 3 years.
Okay.
My main symptoms were, at first, it started with just a little twinge in the side of my face. And then it progressively got worse and worse and worse until it was so incredible. I was having 20, 30 episodes, at least 20 to 30 a day. And it was the kind of pain that would just throw you to your knees. It was awful. Just like a electric shock to my face. Like you stuck your finger in a light socket. And so it was excruciating pain. I was not getting any relief. I tried laser. I tried cranial massage. I tried chiropractic procedures, 2 or 3 different kinds of laser. I just couldn't find any help, and I was getting ready to do surgery. The type where they go in behind your ear and go 2 inches in to your brain and lift up the main artery, because supposedly it was putting pressure on the trigeminal nerve. And they are, I guess, getting some success with that. But I did not want to do that kind of invasive procedure. So
didn't you have that booked a week or two before?
I had it booked. Yes, it was. Yeah. It was about a month before when I found you. Yeah. And I was scheduled. Yes, I was completely. I had already gone in and had the MRI or the CAT scan and everything that I needed to do. I was completely prepped, ready to go. The date was set. Actually, you know what? I think it was maybe 15 days, because I can remember almost resigning myself to the fact that I was going to do the surgery. And then I found you online.
How about that?
I know. And the amazing thing is that I live in Oregon and what I had found, there was somebody in Minnesota and somebody in Texas, and there you were in Eugene, Oregon. And I thought, I can't believe you're in Eugene, Oregon. So, yeah.
That's what all the Oregonians say. And then the people that are flying from out of state are like, have you ever thought about moving to Las Vegas or, whatever?
Of course. But for me, that worked because my brother lives here, so I could come here and come to you and, and then go home the next day. So
sure.
That's what I'll do.
All right. So you were diagnosed with trigeminal neuralgia?
Yes.
Okay. And did they give you any other treatment options other than just the surgery?
No.
Like medications or?
Oh, yeah. They gave me several different types of medication, and I tried them, but I cannot take them. They just, I can't function on them. I just get a very bad reaction to them. So I tried them, and believe me, I was in enough pain that I wanted them to work.
Yeah.
But it wasn't worth the trade-off. And I wasn't feeling relief from the pain anyway, even with them. Okay. So I tried 2 different kinds, and I couldn't function.
So the shocking electric zap in your face that you were getting multiple times a day and a week, was there any other symptoms that accompanied that?
It would travel. I noticed that it traveled for a month or 2. It would be in this area. I couldn't brush my teeth. I couldn't turn on my hairdryer. That would just set it off terribly. But it traveled because originally the trigger point was in this area. Okay. And then it traveled over to maybe more to my jaw, and then up behind my eye.
Okay.
But it never went on this side of the face or anything, but it stayed on this side of the face.
Okay.
I would say when it went behind my eye, it was pretty, a different type of pain almost. And there was a dull, achy type of pain that went along with it. It
was like a constant dull ache that was just...
It was a dull feeling. I don't know whether it was I guess it was an ache, but not terribly. I could withstand it.
Okay.
But it was there.
Okay.
I would say it was definitely there. So Yeah.
So this is what, my third time to see you?
No,
Third or
this is
fourth?
sixth.
Sixth?
Yeah.
Oh, okay.
Yeah, I think 5 or 6.
Okay.
Yeah.
Well, time flies sometimes.
Yeah. But last time we decided to let it rest, and it's been doing okay. I mean, I do notice that it'll act up if don't get enough sleep, or there's stress, or I'm,
Okay.
But it did not go off. I will tell you, I had a very serious situation with the car I was driving in South Carolina, and the alternator went out on me while I was driving in traffic so there was nowhere to pull over.
Yeah.
And I was very, very frightened where I was. And that would normally have set that off, and it didn't, which surprised me.
Okay.
Yeah.
So if you had to give me a percentage of improvement from the day that you walked in here, because I know you were in a pretty bad place when you walked in here that first time, would you say 50%? Would you say 65%? Like, where would you put that mark?
Probably more like 90, because it's still there, but it's not chronic.
Okay. Is it fair to say that when you get you differentiated between an electric shock and just kind of like a little,
okay, so when it does go off now, it hits pretty forcefully. I mean, it's like I'll say maybe a 7, whereas before it was off the chart. No.
Right.
So, and it would hit that quick, a 10 or above. Now when it hits, it's like, maybe a 7, but it's like seconds. It's like 10 seconds at the most, let's say.
Okay.
Whereas before, if it hit, it could be up to 5 minutes or 15 minutes even.
Sure.
Or maybe even sometimes more than that.
Is it fair to say that the intensity, frequency, and duration all have gone down on those shocks?
Yes.
And
absolutely.
How frequently, let's just take the last month since I've seen you. Mm-hmm. How frequently are you getting the shocks?
Maybe I'd say twice a week, but they're minor, like I said.
Right.
They're seconds.
Well, you're kind. I would say those are kind of like middle of the road. If you said, it was like a 2 or a 3, I would say, that's a minor shock. But if you're up in the 6, 7 range, that's kind of middle. And of course, 8, 9, 10, that's like.
Yeah, I would say when they do hit, they're probably a 7.
Okay,
I mean, it's enough to make me stop what I'm doing. You know what I'm saying?
Sure, absolutely.
So, but it doesn't last long.
So
that's the amazing thing.
Are you able to touch your face? I saw you touching your face just a little bit there.
Yeah.
And not fend off the shock.
Yes.
Okay.
Yes.
My guess is, Cathy, you're probably going to just need more and more time. And my hope for you is with time, things just continue to slow down.
Mm-hmm.
The duration, frequency, and intensity of the shocks should get less and less, and hopefully just go away.
Yeah,
%. That would be great.
I do progressively see them less and less, so I do know it. Yeah, I would say.
Well, and I don't know that you being ever like 100% cured of this. I don't know that that's realistic. I would be happy if you're like a 1, 2, or 3, and you get maybe 2 or 3 a month. Like, okay, well,
I'm happy. I can handle that.
Okay, fair enough.
Yeah.
So are you happy you had it done?
Oh, absolutely. Absolutely. I wasn't getting any results anywhere. Okay. So this is the only results I was getting. And I know in the first day you did it, I noticed it. So, remember that first day and I go, wow, I can't believe it. When you question, I forget what you asked me. Asked me something. Like, are you feeling anything right now or whatever? Yeah, it was just, it's amazing.
Well,
I definitely would, absolutely. I would recommend this to anybody who has that. Okay. Absolutely.
Well, I appreciate you sharing your story with me because I think there's a lot of people who get diagnosed with that really have what you have. And what I mean by that is it doesn't diminish the pain just because you were misdiagnosed, right? But
Was I misdiagnosed?
Well, let's think about it. That's a great question. So if you had neuropathic pain that was inside your brain, right? It really wouldn't matter what I did to the teeth. It would still hurt.
Yeah.
Right?
Yeah.
But if I make adjustments to the teeth and all of a sudden your pain starts to diminish, that's not neuropathic pain. That's musculoskeletal issue, right? So by balancing the bite, everything's getting an opportunity to calm down, and you don't need a bite block. You don't need a night guard. You don't need medication. You don't need surgery. It's just getting the bite right, which, by the way, every single dentist is responsible for. All of us, but none of us do it. That's one of the sad things about it, right?
Yeah.
So do you have any questions for me?
I don't.
Okay.
Except what we're doing today. Is this, were we going to do the bite thing? Or?
Yeah. I'm going to check it out.
Oh, I didn't know.
No, we got you all hooked up. I'm going to check it, confirm that you're in a good place. Not that you're like really, off to the right there like you were. But, given you're saying you're having the improvement that you're having, I'm inclined to probably leave you right where you are.
Yeah.
Unless something's really out of whack.
Yeah. Unless
because I want you to get even more improvement. And
okay.
Time is our friend.
Yeah.
Because if you go home and you're like, hey, I'm starting to feel, a ramp up, I can always remove it. But what I don't know is what your bite was like prior to you having all of this pain, right? You might have always been on the right side, but just been off a little bit. So, but if we hit the sweet spot, you're just going to continue to improve until you hit that plateau.
Yeah.
We just don't know what the pre-scan looks like. I know how you walked in when you came in day one, and we're going about it the right way because you're getting the relief. So
yes, I am.
But even if I don't do any adjustments, I don't think we're done. I may kick you out like 2 months, 3 months, and still follow you for a period of time.
Yeah.
Just, make sure that you're still improving, or you've had a plateau and you're like, no, everything you did is holding, and I'm right where you left me off.
Yeah.
Because that's a win too.
Yeah. Oh yeah. It is a win. Yeah.
Any questions for me? Other than that?
Nothing I can think of right now.
All right. Well, thanks for letting me share.
Yeah, sure.
All right.